Okay. Um, Hi everyone. My name is Lisetta Jesus. I did my project on psychological disorders in children. Before I begin, I want to state that I apologize for any noise in the background. I can't control that. I apologize very much. So to begin, we are going to begin with the table of contents. The table of contents is just like a review, not a review, an overview of what my presentation is going to be about today. So I'm just going to state a little bit about it. I did my disorders on two different ones in childhood disorders. We'll get further into that. I just listed like the causes, the symptoms, how it affects a person. I also added video presentations of like to get a better understanding. Not very long videos, but in the end, I feel like it would help you guys understand it more. Um, and also in the end of the PowerPoint, I did like a little quiz review for you guys, just so you guys can get a better understanding of things. So let's begin. So intro to childhood disorders. I have my notes here with me. Um, so to begin, like I said, I did my project on childhood disorders. I don't know, I kind of like drew to children disorders more because like children are precious. So it's very upsetting to see when they have like a disorder or something. So it's also very good to know about these children disorders because I feel like we can help them more. So, children are precious. When we speak about childhood disorders, we are referring to mental and emotional problems that most often occur and are diagnosed when children are school age or younger. Mental disorders among children are described as serious changes in the way children typically learn, behave, and have their emotions, which cause distress and problems getting through the day. Childhood disorder symptoms start during infancy and in early childhood, although some of the disorders may develop throughout adolescence. I just wanted to pinpoint that I didn't, for this presentation, continue the symptoms and like in adolescence. I just focused on childhood disorders mainly. Childhood disorders specifically require that symptoms first appear at some point during their childhood. So this meaning like around the age of preschool, or maybe even before that, like when they start daycare or something. Um, the topics I chose today strictly involve diagnosing children from infancy to early childhood, like I said. Healthcare professionals use the guideline in the American Psychiatric Association diagnosis and the Statistical Manual 5th edition. So the DSM-5, we will discuss that further into the presentation to help discuss diagnose mental health disorders in children. So I chose childhood disorders. I chose two topics under childhood disorders, which is Tourette disorder and expressive language disorder. Um, Tourette disorder can also be known as Tourette syndrome. I'm sorry if I'm saying this wrong, but I feel like it's Tourette. I'm not sure how you pronounce it correctly, but um, TS for Tourette syndrome. So I would be using a lot of like TS just to abbreviation and stuff so we can go with the flow. Um, Tourette is a disorder that lies under childhood disorder category. TS is an inherited disorder. TS causes a child to have what is known as tics. I would explain tics further into the presentation. It's a neurological disorder characterized by repetitive, stereotyped, involuntary movements and vocalizations. This disorder is named after Dr. Georges Gilles de la Tourette. I felt like this was like a fun fact to put in there because it's kind of, I find it very fascinating where you get the names of like a disorder or just things in general where you get the name from. I find it very like interesting to me. Expressive language disorder. Expressive language disorder is when a child or someone has difficulty using words to communicate their needs and ideas. Children have this disorder, which they may leave words out where sentences or get mixed up with word tense and repeat phrases or parts of sentences. This can lead to problems in a social setting and at school. So I'm gonna begin with Tourette disorder. Tourette disorder can also be known as TS. Tourette is a disorder that lies under childhood disorder category. TS causes a child to have what is known as tics. A tic is when a child makes a sudden fast movement or sound that they cannot control. So I guess we may see it as a reflex, like when, say, someone comes in our face and we like jerk really fast. That's basically what a tic is. But for them, a tic is uncontrollable. Excuse me. Um, Children around the ages 7 through 12 or older have TS. A person who has TS might repeatedly blink their eyes, shrug their shoulders, or blurt out offensive words that they don't mean. Um, a child's tic can get worse when they are alone. So, what I mean by this is when a child is, let's say, doing their homework, for example, they're like focusing on the homework, like writing stuff down, and then they just get like a fast jerking movement, like they'll throw their pencil across the room, but they can't control that. So that is what I mean. Like when a child is alone, like it will happen more often. When a child is concentrating and doing activities or sleeping, the tics happen less often. So let's say, let's see an example. A child is playing soccer. So when you're playing soccer, tics don't happen much often because they're focusing on getting the ball into the goal. I have a video here, but I will show that maybe at the end of when I finish talking about Tourette disorders. But I just wanted to say that this video is what Tourette syndrome looks like, along with examples of tics and fast movements, sounds, and blinking of the eyes. Let's continue. I also just put an image here, like when I say like when they shrug their shoulder or blink their eyes, that's basically what a tic looks like in a child. What is it like? Excuse me, I'm just gonna move this a little bit up. What is it like to live with this disorder, and how does it affect one's quality of life? Let me get my notes again. With this disorder, children can often see themselves having trouble to control their tics. The motor and vocal tics of Tourette are involuntary, meaning that people do not do the tic on purpose. They don't, it's uncontrollable. Let's see. While the exact cause of the tic is still unknown, many people who have TS compare the feeling of having a tic being like an itch that is coming in or having to sneeze. So you know when you get that feeling of like when you get to sneeze, it's like a little bit like of a tickle, and like they know, you know, it's coming. So that's basically how a tic feels like when a child or just people in general who have it. Over time, tic behavior changes, meaning depending on how often tics happen to a child. TS is more often seen in boys than girls. I found this very interesting, to be honest, because when I was looking up this disorder, I was like, what? Usually the video I'm going to show you is basically a TikTok video. I know most of you know what TikTok is. I saw it in mostly girls, which was very like not weird to me, but it was very interesting because the internet says that it happens more in boys than girls. But every time I see a video about it, it's only girls that I see. So it was very interesting about that. So according to Nationwide Children, quote, boys are more likely to have long-term chronic tics. Girls are more likely to have obsessive compulsive disorder, OCD, which is an anxiety disorder. When having TS, the tics can cause children to be psychologically distressed when feeling of frustration or low mood in general due to uncontrollable tics, which can affect one's quality of life. So I added this little quote from the Nationwide Children because then when I saw boys have it more than girls, it made a little bit more sense. So this is why I added the quote into this slide right here. So Tourette disorder. Who has this specific disorder and what are the types of TS? Um, Anyone can be diagnosed with this specific disorder, honestly, males and females. As stated before, TS occurs in people from all ethnic groups, so Hispanic, white, African American, anybody can have this. Anybody can have this kind of disorder. But males are more affected 3 times more than females. Most patients with TS, their tics severity before their mid-teen years. So what I mean by this is that, like I said, when I show you the video, I'll explain it a little bit more. In the teens is when, like, I guess you can notice it more. Not notice it more, but you start to see it more. If tics continue after their teens, meaning adolescence, it will extend to majority of the patients in their late teens and early adulthood. Approximately 10 to 15% of those affected have progressive and disabling course that last into adulthood. So, like I said, I didn't want to mention a lot of the adulthood in this presentation because we are focusing on children, but it was just good to know about this specific disorder and who has it. What are the types of TS disorder? There is motor tics and vocal tics. So motor tics are either simple or complex. Simple motor tics are short, quick, controllable movements from one area of the body. Um, Complex motor tics occur when a child has many simple motor tics at once, such as like blinking, tapping on the foot, jumping on the shoulder, or even hitting themselves. Like this all can happen like back to back or at the same time. Vocal tics. Let's continue with vocal tics. Vocal tics can also either be simple or complex. Simple vocal tics are when children make uncontrollable noises and sounds. So like I said in the beginning of this presentation about the offensive words and the phrases that they say that it can be very offensive. This is what I mean about vocal tics. Um, Complex vocal tics are when a children speaks words or phrases without having control over what they say, such as cursing, shouting, and like barking. Barking meaning like a dog or just yelling in general. Cause of Tourette disorder. Although the cause is still unknown, current researchers think that due to the abnormalities in the certain brain regions, including the basal ganglia, the frontal lobes, the cortex, all of these have a circuit that interconnect with these regions, and the neurotransmitter can be a cause. Let's see how I can explain this. So the brain, which is frontal lobe and all of that, have like nerves that connect to each other, and causing this interconnection can cause the tics. I hope I explained it correctly, and I hope you guys understood how I was trying to say it. But let's continue. The neurotransmitters are dopamine, serotonin, and norepinephrine, and they are responsible for communication among the nerve cells. So, like I said, it's the nerves in the brain and stuff. Others say that Tourette are caused by genes from the parents to an offspring. So when a male and a female come together, I guess, and they create an offspring. Whoever has like either the mother or the father have Tourette disorder, they can 50-50 chance send the gene down to the offspring. This is known as hereditary, which I'm sure you guys already know. Um, Next, we are going to do the symptoms. So I found this I guess chart. I found this chart online. While reading it, it made it like I felt like it was more understanding. It was more understanding because they broke it down into motor tics and vocal tics. So I felt like since we are knowing what kind of types of TS there is, this can be like a better understanding of what motor tic symptoms are and then what vocal tic symptoms are. I'm sorry, I'm just going to move this over here. Right there. Okay, so tics, like I said, sudden, brief, intermittent movements or sounds. Severe symptoms can interfere with one's communication, daily functioning, and quality of life. So the first one right here is motor tics. The simple ones and the complex ones. Excuse me. Excuse me. So the simple ones can be like eye blinking, head jerking, shoulder shrugging, eye darting, um, nose twitching, like the little nose twitches, and mouth movements, like a twitch in your mouth. Complex tics for motor tics is like touching something, like grabbing something, or repeating a movement, like jerking your hand repeatedly. I also wanted to um, say like bending and twisting, like when they when you're, I guess an example would be when you're standing, you just like collapse and then you get up again and then you'll collapse again. That's what I mean by like bending and twisting. So next we are going to vocal tics in the TS disorder. The symptoms are grunting, coughing, throat clearing, and barking. Um, I guess it's a basic understanding of what those symptoms are. Um, Excuse me 1 second. Okay. Okay. So complex tics are repeating offensive words, repeating phrases, and using swear words. So it's just I felt like this chart was like a good breakdown of what simple and complex of each not motor tics, but each tick. So I guess it was a good chart, to be honest. Okay. So DSM stands for Diagnostic Statistic Manual Criteria. The DSM is known as Diagnostic Statistic Manual to basically diagnose the syndrome or disorder in a specific category that it falls under. So how my professor explained it to us was that it's a handbook basically that someone uses to see what are the symptoms, what are the behaviors, time and all of that, like time length, I guess you can say. So that's basically what the DSM manual is. A DSM contains descriptions of symptoms and the criteria for diagnosing mental disorders. It provides a common language for clin- clinic clinicians, clinicalins. I don't know. My vocabulary is very horrible. Sorry. To communicate about their patients and establish consistent and reliable diagnosis that can be used in a research and mental disorders. So TS would fall under the category 5. This specific DSM criteria for Tourette syndrome both specify multiple motor and vocal tics, and they present at some time during illness, though not necessarily concurrently. So I'm so sorry. So treatments. I kind of broke it down of like what kind of treatments there are. So as you can see, like self techniques, medication, therapeutic, exposure, and then I broke it down into what you can do under this kind of category. So, but unfortunately, there is no cure for Tourette syndrome. The treatment is usually aimed at controlling tics that interfere with everyday activities and functioning, usually with current medications and self care can help. The tics in Tourette syndrome. So, some self care techniques are deep breathing, medication, yoga, rhythmic exercises, and other activities that reduce symptoms of stress. Um, let's be honest, having these tics can be very stressful for a child. Like, it can be very exhausting. So, some of these self care techniques can help control, like, control the tics that a child is having. Medication, I, in my opinion, I wouldn't recommend medication because you don't know if it's going to get worse or better. So that's just my opinion. But a medication is antipsychotic, which reduces and improves the symptoms of current psychiatric conditions. Mm, like I said, I already said my opinion on that. Therapeutic techniques, which is it can be cognitive behavioral therapy, which is where you talk to a therapist, focusing on the negative thoughts, behaviors, and emotional responses for psychological distress. And then the last one is exposure and response prevention. You talk to a therapy based on your fear and traumatic experiences within a safe setting in order to help reduce psychological distress. So this is the basically the overview of Tourette syndrome. I am now going to show you guys the video of Tourette syndrome. Let me just do that. Make this bigger. And hopefully you guys can hear and see. I don't know if you guys can see it. Beetroot. Cup. Beetroot. Who likes beetroot? Absolutely outrageous. Donkey. So that is the video. Let's. Okay, I don't think you guys got that, but let me just try again. And maybe you guys can see it this time. Beetroot.
Feel like watching. Absolutely outrageous. Okay. So there you go. If you had
I hope you guys saw that video now. I don't know if I was sharing it before, but um, like yeah, as you can see that it was this syndrome, this disorder was in a girl. So and I know I said that it's more often in boys than males. I'm sorry, and then in females, but these are, like I said in before, like I only found videos of females. I guess boys don't want to record themselves having tics. Um, so okay, that's cool. Um, as you can also tell in the video that she was in her teens. So yes, tics and Tourette syndrome can go into adulthood, as you can see, but I didn't focus on that in this presentation. So that's basically everything about Tourette syndrome. We are going to continue with expressive language disorder. So, expressive language disorder in children tend to have difficulty conveying and expressing information in speech, writing, sign language, or gesture. For preschool children, the difficulty expressing themselves in writing is not evident, um, as they have not started formal education. What is it like to live with this disorder? How does it affect one's quality of life? People with expressive language disorder, I believe also, before I continue, I believe also that I used the abbreviation ELD in this disorder section. I'm not too sure if I did, but if you hear me say ELD, that's expressive language disorder. So let's get back. People with expressive language disorder often struggle to form sentences that make sense. They need extra time to answer questions when being asked or take a turn in a conversation. So I speak, they speak, let them take their time in responding, and then I speak again. That's basically what I mean by this. These challenges can make it hard to connect with people, make friends, and form relationships. When a child has this specific language disorder, they tend to have trouble using the language. The children may be able to understand what other people might say, but have trouble when trying to respond or talk. They often can't express what they are feeling and thinking. This disorder can both affect written and spoken language in one's quality of life. It's kind of sad just saying it and thinking about it. So, who has this disorder and what are the types? So, since we are focusing on child psychological disorder, children start to notice symptoms of ELD around the age of 5. The age of 5 is where children tend to start preschool. So, in preschool, you start to learn your ABCs, your one, two, threes. Not too sure what else you learn. I guess your shapes and stuff. Forming sentences like the dog runs or something. I'm not too sure. Preschool was a long time ago for me. Um, but this is the age where kids start to go to preschool and begin to develop more advanced sentences when entering daycare or preschool. When a child is being diagnosed, a speech and language pathologist can administer standardized tests to gauge a child's ability to both comprehend and express their language. I do have a note here. I basically wanted to add on to this that I didn't add on into this PowerPoint because I didn't think it is necessary, but I just think it would have been too much, I guess. So what I mean by standardized test is when the pathologist is showing the child a book and the pathologist goes, show me which one is the apple. They point at the apple. Now the pathologist goes, can you say I like a apple, meaning like I want an apple, or basically let's use that, I want an apple. Um, they can see how the child is going to struggle with it or how they are going to be fluent with it. So that's what I mean. I also have this chart here that I found when a doctor sees your child's development. So this is how a child is supposed to develop. 15 months, babies don't say anything, only like little things or like grunt or something. At 2 years old, they start to use vocabulary, but that is less than 25 words, maybe. 3 years old is when you start to put two words into a sentence. So, like, I go, like, say a child needs to go to the bathroom, I go. That's what they mean. A 3-year-old child is not going to say, I have to go to the bathroom. They just go, I go, or I went. 4 years old is when a child should be putting sentences together. So instead of saying I go, they say I go bathroom or I go to bathroom. It's basically what this chart is. Also, I hope those examples helped you understand it more. Let's continue. Children may develop what is called receptive expressive language disorder. Receptive, meaning that they have difficulty in understanding the language. So this is the type of expressive language disorder. So there's expressive language disorder and receptive language disorder, which I have a video as well on explaining the two. If a child has a hard time understanding what you're saying, they might have receptive expressive language disorder, which is more than ELD. So receptive language disorder is more advanced than just expressive language disorder. They might struggle to understand information, organize thoughts, and follow directions. The cause. So we are going to talk about the cause of expressive language disorder. For many children, the cause of expressive language disorder is not known. Some children experience difficulty in language development alone, while others in their areas of development are progressing as expected. For other children, expressive language disorder is associated with known developmental difficulties and impairments. The condition may be genetic or run in the family. In very rare cases, it can be a brain injury. So that's very rare. I haven't read as much about brain injury, like while researching this kind of disorder. I haven't really read much about the brain injury or malnutrition, which can be a cause for expressive language disorder, but very rarely. Um, I also wanted to go over. I wanted to add associated with known developmental difficulties and impairments, meaning this can also be affected by Down syndrome or autism. Um, yeah, that sounds about right. Yeah, that's what I mean. So I kept it really short for the symptoms because there wasn't quite much on expressive language disorder symptoms. I do want to note that language disorder differs from one child to the next, depending on their age. So I wanted to. The symptoms are difficulty putting words into sentences or in the right order, difficulty finding right word or uses place words like or um, leaving words out of sentences, mixing up word tense, vocabulary level is very low than a regular 5-year-old, and repeating phrases or parts of sentences, or they talk in circles, meaning like they know what they're going to say but can't physically say it. Like an example would be, let's see, it's maybe like a 5-year-old is telling their school story and stuff, but they can't quite say it how it is. Like, oh, we went to the the coloring room. There was orange, there was yellow, there was red, and there was a big butterfly with all these colors, and the child says the specific colors but can't necessarily say it. So this is what talking in circles means. I hope I didn't confuse you. I think I might have just confused myself there, but it's all good. So DSM for this kind of disorder is when a child is diagnosed with ELD. The DSM criteria also falls under DSM-5 diagnostic criteria. The disturbance may be manifest clinically by symptoms that include having markedly limited vocabulary, making errors in tense, or having difficulty recalling words. That's, like I said, not much about the DSM statistic criteria. It's basically the same as the Tourette disease, is where like symptoms are and like the complexity and the how do you say it? Simpal. Let's just continue because I'm just talking right now. Treatments for expressive language disorder. Treatments options depend on the severity of the impairment of this disorder. They may include group sessions with the speech pathologist, individual therapy sessions with the speech pathologist, school-based language. I'm not too sure if any of you guys maybe remember in middle school where you would, I know in my middle school that we had an ELS kind of class, but that was only for children who needed to like learn more English, like, or get further knowledge, like further practice, I guess, further knowledge and practice of um language. So I'm not sure if you guys had that in your middle school. I know I did. They would just like pull random kids out of class at this specific time every day just to, for maybe like 30 minutes or maybe like a whole class period, to just work on this. So this is what I mean by school-based language intervention programs. Um, Assistance for special education teachers, that also goes with the school-based language intervention programs. Teacher's aid also goes with school-based intervention programs. Speech pathology sessions combined with home programs. So like I said in the beginning of expressive language disorder, when a pathologist is trying to diagnose a child to see if they have ELD, they use books and pictures, and they would go home to do that kind of stuff. Like maybe they would use their kind of toys and be like, oh, like how do you use this? So it's very I feel like it's very good to do it more at home because you're more comfortable there. So I think it's very like nice and to do it at home. So video presentation about going to show you another video presentation of expressive language disorder. Let's just this one. This okay. Before I start, this is the receptive and expressive language disorder. It further breaks down what it is basically. So here we go.
Hi there, I'm a speech language pathologist. Today I'm going to talk to you about the difference between receptive and expressive language. So receptive language is language understanding or language comprehension. So this is their ability to do things like follow directions, point to things when you tell them, things like that. Expressive language is language output. So this is everything your kid is able to verbalize, sign. This is kind of like their way of communicating with you. So as an example, we're going to look at the book cover. If you tell your child, point to the apple, and they're able to point to the apple, that shows you that they know that apple means this. So that tells you that they understand the term apple. However, if you point to the apple and you say, what is that? And they're able to verbally tell you it's an apple, that falls under expressive language because they're using their words to communicate and tell you that that's an apple rather than just pointing to it and demonstrating understanding. Hope that helps.
So she explained it way better than I did. So that's basically it for the 2 disorders that I chose for today. Here we go. This presentation is going to start all the way from the beginning now. Finally, we are just going to do a quick little review of this PowerPoint. Very easy. I didn't want to like make it hard on you guys. So the first question is, which disorder is the disorder that causes 1 to have tics? So which disorder causes tics? We all know that is Tourette disorder. Pretty sure you guys got that already. A true or false question. I wanted to put a true or false question into this PowerPoint because I don't know, personally, I like true or false questions. It's just very good to know. It's like facts that you knew or you didn't know. So, true or false, both disorders mentioned in the presentation are a part of DSS category 5. That is true. Next question. How many types of Tourette syndrome are there? 3, 1, 2, or 0? The answer is 2. So when we discussed the types of Tourette syndrome, there is motor and vocal. Those are the only types of Tourette syndromes, which are the motor tics and the vocal tics. And lastly, what exactly is the difference between expressive language disorder and receptive language disorder? I didn't provide an answer for this one. I guess this was kind of like an open-ended question, I guess, which was kind of silly of me to put, but I felt like it was a really good question in my book. I'm pretty sure you guys know expressive language disorder is verbally, receptive language disorder is, how do I say it? Like they use their knowledge of what is what. So like the video, receptive, can you point to the apple for me? Or what is an apple? They point to it. Expressive language disorder is when, what is this picture? And the child says, it's an apple. So that's basically it for my presentation. I hope you guys enjoyed it. I can't wait to see everybody else's presentation, but here is just the not the links, but the sources that I used for this presentation. And that is basically it. So thank you guys so much. I hope you guys enjoyed it. Thank you again, and I can't wait to see your guys' presentation. Thank you.